Pleasant day to everyone. I am Dr. J. Miguel, resident from the Department of Orthopedics, Cagayan Valley Medical Center, Cagayan Valley, Philippines. I want to thank the Asia Pacific Orthopedic Association and the Philippine Orthopedic Association in allowing me to present my research on epidemiological features of traumatic spinal cord injury in a tertiary hospital in Cagayan Valley, a 5-year cross-sectional study. Traumatic spinal cord injury, also known as TSCI, is defined as an acute damage to the spinal cord due to traumatic causes that either temporarily or permanently result in alterations to the function of the spinal cord. Globally, the recorded prevalence and incidence of people living with TSCI is maybe underreported due to the lack of national registry system for spinal cord injuries. Numerous articles on TSCI had been published, particularly in developed countries, because of established TSCI registries and databases. However, in the Philippines, this is only the second hospital-based retrospective study on TSCI. This study aims to examine the demographic and epidemiological characteristics of patients with TSCI admitted in our institution from 2016 to 2020. The following are my specific objectives. This is a hospital-based retrospective cross-sectional medical chart review. The study investigated all patients who satisfied the inclusion criteria and were admitted in CVMC from January 1, 2016 to December 31, 2020. A letter of approval was obtained from IRB and Ethical Review Board prior to the conduct of this study, and the data was protected in accordance with data privacy guidelines. Here are my inclusion and exclusion criteria and the parameters assessed. 145 patients with TSCI was identified from 2016 to 2020. In all patients, 93.10% were males, while 6.90% were females with a male-to-female ratio of 13.5:1. This indicates that males are more likely to develop TSCI due to the nature of their occupations that may entail hazardous environments. The majority of patients who suffered spinal cord injuries were between the ages of 31 and 45, followed by the ages of 46 and 60, with a mean age of 42.13 years. This is consistent with the study of Wang Zining in China. On the other hand, this differs from the study of Wai Zhu in China and the recent study of Tonogan in Iloilo, Philippines in 2020, with 46 to 60 as the most common affected age group. 59.31% of the patients were unemployed, followed by farmers at 24.13% and laborers at 8.97%. The results of the present study were the same as those previously published by Wang Zining and Tonogan. Many of these field work occupations are more prone to injuries. The high incidence of unemployed subjects could be reflective of the high unemployment rate in the locality. The leading mechanism of injury was fall from height at 51.72%, followed by vehicular collisions at 43.45%. These results are similar with those of previous published studies. The difference, however, in the previous studies, most authors differentiated between low height falls versus high height falls. The current study found that cervical injuries were the most common affected level of injury. Previous study also showed that cervical region were the most common level of spinal cord injury, accounting for 54 to 61% of the overall injuries. Majority of the patients have an ASI scale of A at 29.66%, followed by C and B. But this may not reflect the true values because almost half of the patients did not have the standardized ASI scale form included on their medical records, which could be reflective of the inconsistency on documentation at the time. This should be a point of improvement for our institution. 80% of the patients had conservative treatment, while 20% received surgical treatment. The majority of the patients did not undergo surgical treatment due to financial problems and lack of government funds to provide necessary implants. In conclusion, the results was comparable to previous studies. There was a greater incidence among males compared to females. Falls and motor vehicle collisions were the two leading mechanisms of injury. Farmers and laborers had the highest prevalence of high-risk occupations. These are the limitations of our study. The study is retrospective in design. Data collection protocol was not standardized, hence was prone to inadequate documentation, and the study is not multi-center. Our recommendations. The inclusion of a spine trauma form on spine patients will help standardize the data collection process. Having identified the group of patients having a higher risk of acquiring TSCI, efforts should be made to lessen the incidence of injuries to these patients. And in the future, a national Philippine TSCI registry system could be implemented when data collection for spine trauma patients has been standardized. Thank you.